Well, all new here on the 10 o'clock news, we're getting answers when it comes to the Delta variant. Now, DHEC talked about this, a new, more potent strand of the coronavirus today. It seems like we've been talking about it, though, every single day. It is now being classified as a variant of concern by the CDC. So what does that mean? Well, it just means they're monitoring its spread very closely. Health officials say it's around 40% more transmissible, and there is a higher chance that getting it could send you to the hospital.
So we're looking into how you can be protected against this. Matt Kaufax looked into it for us tonight and joins us live in studio to break it all down.
Yeah, good evening, Tori and Cody. The Delta variant, originating in India, actually, where it took a very heavy toll on the population, is now here in the States. There are currently 4 cases in the Palmetto State so far, none of those in the upstate right now. DHEC did warn today, though, that with the 4th of July around the corner, we could potentially see a spike in cases, especially among those who are not vaccinated.
Dr. Emmanuel Sarmiento says the first thing you need to know about the Delta variant is that it is more deadly than the virus it originated from.
It's more contagious and easily transmissible. Second, we know that they actually like to infect the lung cells.
We caught up with the upstate allergist and immunologist today to ask him, who is this affecting the most?
A lot of people that are affected that we see right now are younger, unvaccinated.
The CDC says Delta is now the dominant variant in states like Missouri, where the vaccination rate is 39.1%. South Carolina currently stands at 38.7%.
We don't know that much about it, but yes, I've heard about it.
Neighbors like Dora Edwards tell us they're optimistic when it comes to the variant.
I feel like the vaccines probably are very effective for that variant also. I'm not too concerned about it.
Dr. Sarmiento says that as a vaccinated person, Dora is right to feel safer, but adds younger people aren't getting vaccinated fast enough.
It's very concerning. There is a correlation between unvaccinated people and the rate of infection.
He says studies already show that getting vaccinated, particularly if it's the Moderna or Pfizer mRNA vaccine, protects you and not just against normal COVID.
The Alpha variant, which is from the UK, is about 93%. And guess what? They also look at the Delta variant. It ranges from 88 to about 90% effective. It's the only way to prevent the spread and to stop the infection.
And you might have seen there in that graphic that if you only get 1 dose as opposed to both doses, it's around 33 to 35% effective. So a huge jump from about that number to about 90. There are still studies being done on that single dose J&J vaccine effectiveness versus the Delta variant. Early numbers from the FDA show about a 60% efficacy rate, which is still very good and will potentially keep you out of the hospital. We will update you when we know more. Cody, Tori?